So we'll start.
We'll start.
Good evening, everybody, respected seniors and my dear colleagues. Being an anesthesiologist is one of the most challenging yet rewarding roles in medicine. Every day, anesthesiologists carry the responsibility of patient safety, managing critical situations, and making quick life-saving decisions. But along with that, these responsibilities come silent challenges, stress, long working hours, and lifestyle issues that can affect both personal and professional well-being. This webinar, Wellness Matters for Every Anesthesiologist, is designed to create awareness and provide practical insights into two important areas: the psychological challenges faced by anesthesiologists and the growing impact of lifestyle diseases. Through these sessions, we aim to help you all understand these issues better and share simple, resilient, and effective strategies to build and maintain the balance and improve overall health. Join us to pause, reflect, and invest in your own well being because caring for yourself is first step towards caring for others. So I invite today's moderator, Dr. Naina Darvi. She is additional professor at HBT Medical College and R.N. Cooper Hospital. Over to you, Dr. Naina.
Thank you. Thank you, Yogita. Good evening, respected office bearers of SAMS, ISA Mumbai Metro, and dear friends. A very warm welcome from Department of Anesthesiology, HBT Medical College, and Dr. R.N. Cooper Municipal Hospital, Mumbai. In the beginning, I would like to invite Dr. Anita Shetty, Professor and Head, Department of Anesthesiology, HBT Medical College, to chair this webinar. Madam is a member of Maharashtra GC currently. Welcome, Madam. I also invite Dr. Sona Dave, Professor, Department of Anesthesiology, TN Medical College and Nair Hospital, to be the chairperson for this session. She's the president of ISA Mumbai Metro currently. So let's begin with our today's webinar on wellness matters for every anesthesiologist. Our first speaker for today's webinar is Dr. Shubha Mohite, a senior anesthesiologist with a career spanning over 45 years. Madam has been a student of TN Medical College and faculty for a long time before joining as a professor and head, Department of Anesthesiology, LTMMC Sion. After retiring from Sion Hospital, she worked as a professor and then head in Dr. D.Y. Patil Medical College for 11 years. Madam she held numerous positions and has many degrees and publications in her kitty. But today I would like to tell about her outstanding quality, which is her uncanny ability to identify the emotional troubles her students or colleagues may be having. She has been a philosophical guide and counselor to many of us. She continued this passion to understand human psyche, its intricacies, and journey towards better and fulfilling life. She has studied Bhagavad Gita, has read numerous philosophical books. Today, she will be talking about psychological challenges for an anesthesiologist and what strategies we can adapt for support and resilience at both our professional and personal lives. It's my privilege to invite my PG guide, Madam Mohite, who is joining us today from Singapore.
Thank you, Naina. Hello, friends. I'm very happy to meet you here on this platform this evening. After spending more than 40 years in anesthesia, I became interested in psychology. And then I realized that psychology not only pervades, but it also flourishes our personal as well as professional lives. So let me share my views with you. So I will be sharing with you the applications of psychology, psychology in anesthesiology, important concepts of psychology, putting psychology into practice, psychotherapy, and lastly, the conclusion. So, applications of psychology. See, there are so many fields where now psychology is very, very important. And for example, in the sports, increased resilience impacts the performance. In child psychology, the counseling of parents is also very important. For industries and businesses, they always have HR departments, and we know the importance of HR departments for the well being of the personnel working there. Now, this is one profession which shares similar type of work where focus is required. Decision making is there in critical times. Stress regulation is uh, required. Safety of the aeroplane as well as for the of the passengers is very important. Teamwork is required each movement, and resilience is also required for pilots. Now coming to psychology in anesthesiology. Supposing there is unexpected difficult intubation, then we know what happens to us. And the second picture, such individuals are not at all uncommon in OT environment. So anesthesiologist has to balance his or her own problems as well as the problems of personnel who's working with them. Imposter syndrome is very common in anesthesiology. It is persistent self-doubt despite competence. The common thoughts are, I'm just lucky, but I may not be good enough. The triggers are high stake decisions that we have to take every moment. A small mistake also can lead to catastrophe. Limited recognition. We always work behind the screen, and perfectionism is the requirement of our profession. So the impact is stress, anxiety, burnout, depression, and avoidance of leadership roles. The solution is self awareness, focus on learning, and grow. Self development leads to self growth. Personal well being is necessary for enhanced professional efficiency. It improves emotional intelligence and resilience. This, in turn, leads to better communication, better handling of personal conflicts, and smoother teamwork, better patient outcomes. What are the important concepts? The first one is anatomy. The important areas of the brain are amygdala, hippocampus, and prefrontal cortex. Amygdala and hippocampus being parts of limbic system. Amygdala is concerned with emotional intelligence. Emotional memories are there. It also regulates behavior and initiates fear response. Whereas hippocampus is important for short-term memory, navigation, and learning, emotional intelligence. Now, coming to prefrontal area, it is important for abstract thinking, problem solving, planning, and emotional regulation. It regulates emotions by regulating amygdala as well as hippocampus. We know vagus nerve, it has got widespread innervations in the body and has an effect on wide span of bodily functions. It innervates almost all the internal organs of the body. So it is the main nerve of parasympathetic system responsible for calming the mind and body and returning to homeostasis. It is also known as the rest and digest state after periods of stress or sympathetic activation. Now, coming to the second concept, that is neuroplasticity. We are aware of it. After having stroke, the patients recover their functions if they take efforts towards it. So, neuroplasticity refers to the brain's extraordinary ability to change and adapt throughout your life. So, this same property is important for growing, learning, and adapting. We have to remember this. Now, coming to the third concept, that is primary emotions. They are basic, instinctive emotional responses to stimuli and often considered universal across cultures. So, I have put some emojis, pictures are there. So, they correspond to fear, sadness, anger, happiness, surprise, and disgust. The characteristics are they are direct characteristics of emotions. They are direct, immediate, and often recognizable through facial expressions. Then, what are secondary emotions? These are emotional responses that occur after primary emotion, often stemming from how we think and interpret our primary feelings. The examples are guilt, shame, jealousy, embarrassment, pride, resentment. The characteristics are they are reactions to those primary emotions. They are more complex and involve more cognitive interpretation. They are influenced by personal beliefs. Now, some facts about emotions. In psychology, it is accepted that no other person is responsible for your feelings. Your own way of thinking is responsible for your emotional responses. One can learn new ways of thinking. So, this is neuroplasticity. And we have to remember that our emotions and moods are contagious. So, another faculty is focus. It is the ability to concentrate one's attention or sustain concentration. It can be selective or focused attention or divided or unfocused attention. Actually, we can focus only on one thing at a time. When we are doing multiple things at a time, that is what anesthetists are doing in the operation theater. We have fleeting attention. What are the factors that affect focus? They are internal distractors or external distractors. So, internal distractors are previous similar type of experience, or you meet a person with whom you had some bad experience. Future thinking, we do not remain in the present moment. Stress, physical tiredness, and lack of motivation are other factors. External distractors are visual, auditory, and weather changes. So, putting psychology into practice. Again, coming to the operation theater environment, sometimes we have to manage so many things. I remember one incident where the laparoscopy was, the surgery was done. I do not remember exactly for what, but it was laparoscopy. And as soon as the trocar was put in, there was fountain of blood. And after that, can you imagine? We had to resuscitate two patients. One, the patient on table, and other, the patient off table. And that was the surgeon. So in the operation theaters, we face so many such and other experiences. And under those circumstances, what is the desired outcome? Maintain focus under pressure, prevent emotional spillover because emotions are contagious, reduce cognitive overload, support patient safety, build resilience, and build emotional intelligence. Now, these are some methods that we should learn and practice it. Mindful breathing is one thing. This is a technique where attention is focused on the sensation of breath, noticing the rise and fall of abdomen, the air entering and leaving lungs without trying to change it. How mindful breathing helps. Mindful breathing reduces stress by engaging the parasympathetic nervous system, which counteracts the uh, fright and flight response associated with stress by promoting a sense of calm through focused attention. By deliberately slowing and deepening breath, signal is given to brain and body that the person is in a safe and relaxed state, leading to a reduction in stress hormones and physiological responses. Emotional intelligence is a skill and we should learn it. This is to understand one's own emotions, to understand another person's emotions, taking responsibility of one's own responses, behavior in accordance with social circumstances and requirements, and to be able to build up new relationships and to respect other people. So, how do we understand other person's emotions? It is also called as empathy. It is by active listening. Non-verbal cues like body language, the tone of voice, and we should provide a safe space for the emotion being expressed. Now, this is a tool that we can use. This is called a time management matrix. There are four quadrants: quadrant 1, 2, 3, and 4. Quadrant 1, it, it indicates activities which are important and urgent. Quadrant 2, not urgent and but important. Quadrant 3 is not important but urgent. It may not be urgent for the person concerned. And quadrant 4 is time wasters, not important and not urgent also. So let us think in our scenario. Quadrant 1, crisis management, emergencies, patient resuscitation, unexpected surgical complication. All these activities, they fall in quadrant 1. Whereas planning and prevention, preoperative assessment, protocol developments, CPR workshops, skill upgradation, they are the activities that belong to this quadrant, quadrant 2. So let me tell you here that quadrant 2 activities are very important for having smooth activities in quadrant 1. Quadrant 3 is not important but urgent. So, like urgent requests from administration, where it is not important for the anesthetist who is working in operation theater at that time. And quadrant 4 is time wasters like unfocused browsing. So, coming back to our situation, the challenges, if such an incident happened in operation theater, then what can be done? What is the first aid? Deep and mindful breathing. It is 4 4 4. That is inhalation for 4 seconds, holding the breath for 4 seconds, exhalation for 4 seconds, and holding the breath again for 4 seconds. If we do 3 to 4 cycles of such activity, it will activate parasympathetic system and calmness will prevail. There will be mental clarity, emotional control, and crisis readiness. And let me tell you here that these activities are tested and scientifically proved. Okay, though they appear very simple, they are important and effective activities. Then, number 2 is grounding. There is 5 4 3 2 1 method. So, to reduce the stress and break the cycle of overthinking, we have to see 5 things in operation theater. 4 things we have to touch. 3 things, 3 sounds we have to hear. 2 smells and 1 taste. A taste may be your own saliva. But this takes away our concentration on other side, on something else, and then we can resume our work with a calm and contented mindset. Positive self talk. For example, I may think I might lose this patient. That is one way. But I have a choice to say that I have skills and support to handle this. And that works very well. Then coming to micro breaks, they are 10 to 15 seconds pauses. They may be brief posture change, or maybe you can have a glass of water or something. It would help to refocus. Now, coming to psychotherapy. When should we seek help? When there is burnout, persistent anxiety, depression, and strained relationships, maybe with our surgeon colleagues, or maybe amongst ourselves, or maybe with family members. What are the characteristics that are common for all the psychotherapies? All the therapies are based on interpersonal relationship. They use verbal communication between 2 or more people as healing element. Specific expertise on the part of therapist in using communication and relationship in healing way. So what are they? They are psychoanalytic, humanistic, behavioral, and cognitive. Psychoanalytic. They are the oldest form of psychotherapy founded by Sigmund Freud. Classical method involves years of multiple weekly sessions. Psychoanalysis is less common today because of its length and limited evidence base, but it remains valuable in some complex cases. Coming to the second one, that is humanistic. It is founded by Maslow. So this is a Maslow's pyramid of hierarchy of needs, with most basic needs of survival at the bottom and highest needs at the top. People move up the pyramid as they go through life. The core principles are empathy, authenticity, a genuine, transparent relationship between therapist and client is formed. Self actualization by helping the individuals to reach their fullest potential. How it works? By managing burnout and stress, creating awareness, enhancing empathy and communication between patient, maybe surgical team, or maybe staff. Emotional regulation. It will produce personal growth and support to work-life balance. The next one is behavioral therapy. It is also known as rational emotive behavior therapy. It was founded by Albert Ellis, and he, in this theory, they believe that there is activating agent, which is actual event, and or patient's immediate interpretation of event. So the activating event will give rise to consequences or effects. Consequences may be in the form of emotions, behaviors, or other thoughts. But the consequences do not occur directly. It goes through the beliefs. So, now what are the beliefs? Beliefs are deeply rooted thoughts, and they are inculcated uh, in the very childhood, maybe by parents, maybe schools, or sometimes even religion. So these beliefs may be rational belief or irrational belief. If belief is rational, it will lead to a favorable consequence for the person. And if it is irrational belief, then the, the consequence may not be good for that person's emotional or psychological health. Now, let me give you one example from our field. Supposing patient develops unexpected complication post-operative, and now, as anesthesiologist, I have irrational belief that this shouldn't have happened. That means I'm incompetent. The consequence will be depression. But supposing with same activating event of patient developing unexpected complication post-operatively, I have now rational belief. I have changed my irrational belief to rational one, that now I feel that I did my best according to what I knew in my subject and the tools that I had. Still, medicine always carries risk. So now with this rational belief, the outcome will be realistic evaluation, calmness, and motivation to learn. So in one incidence, it is depression, the consequence is depression, whereas in the other one, where the belief is rational, the consequence is beneficial for the well-being of person. Now the next one. So here we replace the irrational beliefs by the rational ones for a good outcome. So the last one is cognitive. So here this therapy was founded by Carol Dweck. So she believes that some people have fixed mindset and other people have growth mindset. Fixed mindset people believe that the abilities are fixed traits. One is born with it, and such people avoid challenges and fear failure. Whereas growth mindset people, they believe that abilities can be developed through effort, so they can embrace challenges and learn from failure. So now I can give an example from our own field. Supposing a person has a fixed mindset, so he will think that I can't handle cardiac cases, they are very complex. Whereas a person with growth mindset will think cardiac cases are tough, but with preparation and support, I can master it. So that is the difference that can be made by using psychology. So, to conclude, emotional self regulation, empathy, and improved focus and stress management are skills for everyone. Use the property of neuroplasticity to your advantage. Concepts used in psychotherapy can be uh, applied to improve psychological well-being, can be studied and applied to improve psychological well-being. These are few books for further reading, and this is my email address. And thank you so much. I really thank everyone profusely. I'm very happy today being here. Thank you.
Thanks a lot, madam, for that insightful talk and a very refreshing approach towards life and the small tips to maintain our work-life balance. And thanks a lot for joining us from Singapore so at such late hours. I request all of you to put questions in the chat box so that we can discuss them at the end of our webinar. And let's now move to our second talk of today's webinar. I would like to invite our next speaker, Dr. Swati Pradhan. Dr. Swati Pradhan is a freelancing anesthetist in Thane. After completing her MD anesthesiology from LTMMC Science, she has worked as a lecturer there for 6 years before starting her private practice. She has done her EDRA fellowship. She is actively involved with ISA Thane and has been part of many anesthesia conferences and workshops. She has always been passionate about physical well-being and well-balanced diet. We have been colleagues in science and have seen her passionately talking about good nutrition. She pursued this passion of hers and started her obesity clinic, Live Light Center for Medical Weight Loss in 2015. She will be opening her second branch in Juhu next week, and congratulations for that. She has a scope certification and is a fellow of World Obesity Federation. She has clients not only from India, but from many other countries too. She has completed successful 10 years in this field, helping people collectively lose thousands of kgs of weight with special interest in PCOD, pre-IVF weight loss, metabolic syndrome, etc. Just to mention, she's also a winner of MediQueen pageant in 2023. So a true beauty with brains. Today she will be talking on lifestyle disease. Objects in the mirror are closer than they appear. Welcome, Swati.
Thank you, Naina madam. At the outset, I would like to thank ISA Mumbai Metro Branch and Cooper Hospital, and especially Dr. Naina Davi madam for inviting me for this talk. And this is a topic which is very close to my heart. And after Moite madam's lecture, I realize I have to fill in very big shoes. So I hope I can do justice to this. I gather that I am addressing a very august forum of anesthesiologists, and being in postgraduates at least, and then professors and associate professors and all. This demographic is about 25 years of age. And so, taking that into account, I will be talking about now the physical part of your lifestyle, and how it will, how certain your environment and your day-to-day habits will impact your health, and what you can do to minimize the damage that it can cause in the long term, and to increase the longevity and to improve the quality of your life. So I should start by sharing
But
my
share. Yeah.
Yeah. So, lifestyle diseases. Now, as anesthetists and as doctors, we already know what are lifestyle diseases. But how do I make it more relevant for you? By making it more urgent and more present. So that's why this title, that objects in the mirror are closer than they appear. So, the lifestyle diseases will creep up on you much earlier than you think they will. We have this attitude of thinking that this is not going to happen to me, but believe me, I mean, you have to be on the lookout for this. So what are lifestyle diseases? These are ailments that are primarily based on the day-to-day habits of an individual. So these are a part of the non-communicable diseases. They are not because of any pathogens or an infection, but these are diseases which are because of your day-to-day habits, your physical activity, eating, etc., so on and so forth. So, as you can see, these are the different lifestyle diseases. This is cardiovascular, obesity, diabetes, cancer, chronic respiratory diseases, mental health disorders. We also see a huge surgence of obstructive sleep apnea, PCOS, infertility, which is not really defined as lifestyle diseases, but I see a huge surge in these cases nowadays. So I thought that I should include them in this. So. Coming to just to show you how important this is, the NCDs, the non-communicable diseases, accounted for almost 68% deaths globally and 60% deaths in India. So there has been a rapid shift from mortality from communicable diseases to non-communicable diseases, of which lifestyle disease form a cluster. Year two, as you can see in the trend from 1990 to 2021, the biggest killer in 1990 was diarrheal diseases in India, whereas that COVID notwithstanding became ischemic heart disease in 2021. In over a 15-year trend, if you see here, diabetes mellitus was at 32 million in 2010, and it tripled to 97 million in 2025. Obesity also was at 10.7% in 2010, and it more than doubled to 24% in 2025. The risk factors for this, sorry about the thing. Just a minute, my slides are. Yeah. Yeah. So, the factors that contribute to these lifestyle diseases can be poor nutrition. Here, I would like to say that it is pure poor nutrition, not lower calorie intake. It is the quality of the nutrition that matters. A sedentary lifestyle, stress, poor sleep, and substance abuse, which may be caused because of stress. Now, if we now we have discussed what are lifestyle diseases and what can cause the lifestyle diseases. Now, other very important component that I would like to talk about is metabolic syndrome. This again is a cluster of metabolic defects like hypertriglyceridemia, insulin resistance, visceral obesity, atherosclerotic cardiovascular diseases, and hypertension, which are defined as the metabolic syndrome. And both metabolic syndrome as well as lifestyle diseases require the intervention required is your lifestyle intervention. This is the first line of treatment for both. Okay. So how do you detect that you are on the verge of a metabolic syndrome? If you have a truncal obesity or a central obesity, wherein in males your waist circumference is more than 35 inches, and in females if your waist circumference is more than 31 inches, if your blood pressure is above 130 by 85, if you have fasting glucose of more than 100 milligrams per deciliter, if your triglycerides have increased and they are more than 150 milligrams per deciliter, or if the HDL is lower than 40 in males and lower than 50 in females. Now, these are 5 parameters. Out of this, if 3 are positive, then you are having metabolic syndrome and you should start acting on it. Whenever we talk about metabolic syndrome, we have to talk about insulin resistance, which is at the crux of the metabolic syndrome. The main two components of metabolic syndrome are obesity and diabetes, and insulin resistance is at the crux of it. Now, very quickly, I'm going to go through the technical part of this. You have to bear with me a little technical part just for 5 minutes. So, what is insulin resistance? When the insulin is functioning normally, your glucose from the circulation enters the target organs, and then it is undergoes the glucose metabolism, and that is how it is utilized. But in insulin resistance, this glucose cannot be transported into the target organs. There is increased glucose in circulation. There is hyperglycemia, and then there is reactive hyperinsulinemia. Okay, and how does this happen? So, quickly going through this, when insulin first it binds with the IRS receptors in the target organs like muscles, livers, and adipocytes, it then activates the signal transduction pathways. By the activation of the signal transduction pathways, there is a expression of the GLUT4 transporter. This GLUT4 transporter is what it goes to the surface of those cell membranes, and it acts like a gate. Through this gate, the glucose enters the cell in the target organs like liver, muscle, and adipocyte, and then undergoes further metabolism. Now, what happens in insulin resistance is, after the binding of the insulin to the IRS receptors, there is no activation of, there is dysregulation of the signal transduction pathways, and thus the GLUT4 transporter is not expressed at all on the cell membranes, and thus there is no transportation of glucose into the target cells. Okay, so thus there is increased, there is hyperglycemia, and there is a rebound hyperinsulinemia. Reactive hyperinsulinemia. Why does this happen? When there is now intake and output. Intake is whatever you eat, your calorie intake, and output is your exercise or your physical activity. Now, if there is increased energy intake and decreased energy expenditure, then there is a positive energy balance. There is a saturation of the adipocytes, and there is lipodystrophy. This causes a low-grade inflammation, and inflammatory cytokines are released in the circulation. These inflammatory cytokines are what cause the dysregulation of the signal transduction pathways, and this eventually leads to the insulin resistance. So this is how your adipose tissues cause dysregulation of the signal transduction pathway and cause insulin resistance. Now, also because of the adipocytes, there is dysregulation of the adipokines, which are hormones released by the adipocytes. So the adiponectin and leptin. So if there is decreased adiponectin, there is insulin resistance in muscles. If there is increased leptin, there is insulin resistance in the liver. So this is how it causes further insulin resistance. Also, when we have always learned that insulin resistance and obesity are interlinked, correct? So this insulin resist when we have insulin resistance, in the adipocytes, the triglycerides they undergo lysis by the help of the hormone dependent lipases. This action of the hormone dependent lipases is dysregulated because of insulin resistance. So here you can see that because of and this leads to increase in the adiposity, especially the abdominal adiposity. So here you can see that how insulin resistance leads to more abdominal adiposity, and how this highly metabolically active abdominal adipose tissue causes release of inflammatory cytokines and dysregulation of the signal transduction pathway, leading to insulin resistance. So adiposity leading to insulin resistance, and insulin resistance leading to adiposity. So it becomes a vicious cycle. I hope that has become very clear. So thus there is a strong association between obesity and insulin resistance, and one needs to break that cycle. Also, because of when there is increased when there is increased adiposity, there is a take up of these triglycerides in the liver, and leading to fatty liver. The fatty liver leaches LDLs into the circulation, and this leads to atherosclerotic cardiovascular diseases. One of the reasons that many endocrinologists they start patients on metformin and thiazolidines is because they are a first line treatment for adiponectin deficiency, and this is how biguanides are given for weight loss. Now, if you look at the treatment of metabolic syndrome, that also includes dietary intervention, physical activity, and again, lifestyle intervention. So, just like for lifestyle diseases, you need lifestyle intervention, so also for the metabolic syndrome, you need lifestyle intervention. Uh, um, Thus, I reiterate my fact that there is a strong overlap between lifestyle disease and metabolic syndrome. Coming to obesity, it is defined as an abnormal or excessive fat accumulation in the body that presents a risk to the health. There are various diseases or comorbidities which are associated with obesity, like heart disease, hypertension, type 2 diabetes, osteoarthritis, hyperlipidemia, OSA. There is a classification for obesity called as the Edmonton classification, where stage and it is based on the medical, mental, and functional status of the individual. Okay, it is from stage 0 to stage 4, where stage 0 is when there are no clinical dysfunctions, like the patient is functioning well, he may be overweight, but there are no limitations in his mental function. There is no anxiety. The patient is happy, well, has good mental well-being. His all his physical parameters are within normal limits, and there is no functional limitations. Stage 1 is there when there are certain subclinical you can see it here. Stage 1 is when the patient has started getting certain subclinical symptoms, like a slight rise in his blood pressure, a little fatigue, a little sense of irritation. Stage 2 is when you are having established comorbidities, like there is also in stage 1 you can say there is a little insulin resistance or pre-diabetes. In stage 2 there will be established hypertension, established established diabetes mellitus, there is functional limitations. Patient may not be able to climb stairs. There are psychological disturbances, anxiety, or even depression. There is limitation of day-to-day functions. In stage 3, there is it can lead to even end organ damage, like there may be CRF, there may be heart failure. The patient is severely limited in their day-to-day function. Severe osteoarthritis may be requiring knee replacement, and there is the patient may have severe psychological disorders like depression. And stage 4 is potentially life threatening. So just I have just given you an overview of these stages, and we are going to revisit them at a later point. Okay, now coming to the different comorbidities which are associated with obesity, like MASH. As you all know, NASH, the term NASH is not used anymore. Non-alcoholic steatohepatitis is not used anymore. It is now metabolically metabolic syndrome associated steatohepatitis. Okay, and the defining factor, the lab investigations. Just give me a moment. There is some disturbance. Let me just take care of that. Extremely sorry about that. Am I audible? Am I
You're
audible?
audible. Yeah, you're very clear.
Yeah, okay. So, coming to this metabolic dysfunction associated steatohepatitis, what we are supposed to look at in your LFTs are although the LFTs will be raised, the AST to ALT ratio will be less than 1, whereas it is more than 2 in the alcoholic fatty liver disease. So, this is a Diritis ratio which you have to look. Once you see this, then that raises suspicion of MASH, and one can go in for a sonography or MRI or a fibroscan to establish the staging of the fatty liver. Depression and obesity are strongly linked because and both are disorders of stress. In obesity, there's a strong dysregulation of the hypothalamic pituitary axis, which leads to dysregulation of glucocorticoids, leptin, and hyperinsulinemia, again leading to insulin resistance and obesity. Now coming to OSA, this is another thing that we see a lot nowadays, especially in people with truncal obesity or visceral obesity. So if y'all here, I would like y'all to just self-observe and see if there is a increased waist girth, and whether y'all are having any daytime tiredness, daytime somnolence, and many a times now apnea hypoapnea index occurs much at a much higher level, whereas now what they look at is the respiratory disturbance index. So earlier the intervention used to be at apnea hypoapnea index. Now the intervention is suggested at a respiratory disturbance index. Okay, that is even before the upper airway resistance syndrome occurs. So even before there is upper airway resistance syndrome and before there is apnea, before that we already have the respiratory disturbance, which leads to increased effort, respiratory effort, which lasts more than 10 seconds, and this can lead to disturbance of your sleep cycle, and thus it can trigger your stress hormones. And inadequate sleep will lead to your daytime somnolence. Now, another big rising issue that we can see, health issue, is polycystic ovarian syndrome. This again is one of the comorbidities that we are seeing with obesity. Okay, the insulin resistance leads to hyperandrogenism, which can lead to PCOS. Also, the insulin hyperinsulinemia leading to hypoandrogenism and PCOS. And also, the insulin resistance leads to decrease in oocyte development and follicular growth, leading to infertility. There is a even in our professionals, you can see that there is a rising trend of these dysfunctions coming even if a person is trying to undergo IVF, the one of if there is obesity, one of the first things that they are advised is to undergo weight loss, because insulin resistance leading to compensatory hyperinsulinemia causes decidualization of the endometrium. Thus, this decreases the implantation rate, the clinical pregnancy rate, and also the ongoing pregnancy rate. Okay, as it is in a medical profession, we see very late pregnancies, and do not want to further compromise these because of our lifestyle challenges leading to obesity and insulin resistance. Now, another another topic which is very close to me is sarcopenic obesity, which is the thin fat Indian. Okay, although we are of a small build and may on the face of it occur lighter and not so fat, but the fat percentage of the individuals is quite high, because sarcopenic obesity, as you can see, means that there is decreased muscle mass, but there is increased fat percentage. Okay, so there is decreased muscle mass, there is decreased functionality in the presence of obesity. It is characterized by a poor grip strength, so basically a poor muscular strength, history of immobility, and a slow gait. So these patients you can typically see, I would not even say patients, even individuals who are typically not very active, they're very slow moving around, not much physical activity, their strength is not very good. They, if you ask them to carry their some to do some work which is more than usual, they get tired. So these are the thin fat Indians that we see, basically seen in the Asians. How is sarcopenic obesity, how do you develop that? In obesity, again, because of insulin resistance, there's decreased glycogen uptake in the muscles, and thus this leads to muscle wasting. With a smaller mass of muscles, the energy expenditure is less, which leads to a positive energy balance, and thus leading to more obesity. So obesity leading to sarcopenia, and sarcopenia leading to obesity. This again becomes a vicious cycle. So how do you prevent sarcopenic obesity? That is by increasing your muscle mass and by decreasing your obesity. So basically through diet and through physical activity. So one should look at a diet with high quality proteins. Uh, Look at a diet with high quality proteins, exercise, and lifestyle modification. Okay, the exercise will cause vasodilatation, increase nutrient delivery to the muscles, increase mitochondrial function, and thus activation of the skeletal muscle satellite cells. So basically, you have to develop more muscle mass and decrease your obesity. The high quality protein should be around 25 to 30 grams of high quality protein per meal, and leucine should be included in your diet, which is the most potent branch chain amino acid for stimulation of protein synthesis. World Obesity Day is celebrated every year on 4th of March, and the theme for this year is changing systems for healthier lives. Okay. Now, this is very important because wherein you have there should be a collaboration between policymakers, healthcare professionals, and communities to reshape the environment and to create healthier systems. Policymakers, like even in school, one should give more a little more weightage should be given to sports. There are schools which will not give holidays because the child has to go to another town for a sporting event. So there should be more support of such things, that physical activity should be given importance, wherein children are encouraged from a young age to engage in sports and some kind of physical activity. Healthcare professionals, simple like doctors, general practitioners, practitioners also should take more, should not shy away from discussing obesity and their concerns with their patients. And also communities, like societies, should develop healthier environment so that physical activity is promoted. Like, and even schools should have cafeterias where there should be healthy food served. Even in workplaces, they should encourage eating healthy. They should have activity centers for their workers. And governments should have facilities so that people can walk to work. There should be cycling tracks. There should be safety and facility for these activities. Like just having a good footpath, which we don't have in our country. Now this slide is very important. Just like this is a this is a derivation of the Edmonton classification or the Edmonton staging system. So in this you can see that when we are at stage 0 and at stage 1, okay, at stage 0 and stage 1 throughout to stage 4, you can manage with lifestyle interventions, okay, that is exercise, diet and counseling. But once you are at stage 2, then you need clinical intervention to take care of your health, which includes pharmaceutical health. Okay, so do you want to reach stage 2 or do you want to intervene at stage 1 itself? Okay, so this is the reason we say that lifestyle diseases are closer than they appear, because the minute you feel that okay, there is a little decrease in my functionality, there are some changes that are creeping up, there I can feel that there is some inflammation, that is when you should first start intervening, not wait till your fasting blood sugars have started changing, or wait till you have started creeping up 130 by 80, 85 has gone to 140 by 90. Do not wait till then. You do not want to go to pharmaceutical intervention. And once you reach stage 3 and stage 4, that is when you will have to go in for surgical intervention, okay, like a BS or bariatric surgery or something. So we want to arrest it at stage 0 and stage 1 itself. We do not want to go to stage 2, 3, 4 at all. So again, we come back to the same thing, that how you raise your alarm bells. Be alert. Okay. Do not wait till that middle starts spreading, till your waist circumference starts increasing. Do not wait till it goes to a point of no return. Check your parameters. Check your waist circumference. Keep doing your annual checkups. Keep checking your blood sugar, your fasting blood sugar, your fasting serum insulin, your LFTs. Check your AST, your ALT. Okay, check your lipid profile. Okay, so keep checking these, keep doing the tests. Okay, now with the I'll tell you why it is, why you have to do it at a younger age now. So now, traditional belief systems. Okay, coming to this. Now, in my OPD, even otherwise, if a person, or if I ask a person, ki, were you always overweight? So they say, I was always healthy since childhood. So they will never call themselves fat or obese or overweight. They will call it as healthy. Okay, so that is that first belief system, that you should stop, that fat is healthy or looking a little chubby is healthy. We have to stop it there itself. That springs from a time which was about pre-independence, when there used to be famine, mortality was because of tuberculosis, consumption, or lack of nutrition because of poverty. And at that time, looking a little plump meant that you were healthy, that you were well off. Okay, that is the time when the fat used to be equivalent to healthy. Not anymore. Okay, we have come, we just celebrated 79 years of independence, and now we have come a long way. So fat cannot be equated to healthy anymore. Stop calling a child healthy. Realize that he is going into insulin resistance, and the next step is going to be childhood obesity, childhood diabetes, and work on it. So this is where you have to stop calling that okay, that little chubbiness is nice and all. No, you have to look at it from a very objective way. Then again, coming to dietary patterns, earlier it used to be home cooked food, locally sourced, and time restricted eating. We would not have late night binging and all that. But now all that is gone. We do a lot of Swiggy, Zomato, call we food coming from I don't know where with a lot of preservatives, additives. So and there is late night eating, binge eating. So all that has gone for a toss. Now, coming to work, initially their work used to be labor intensive, more blue collar workers, agriculture based. So we needed a carbohydrate heavy diet, because when you look at physical activity and you look at the calorie requirement for physical activities, the first burst of energy, the slow burning energy, comes from your fat. And then the burst of energy that you need for intense physical activity comes from carbohydrates. So our traditional diet used to be very carbohydrate heavy, rice, chapati, bhakri, all that. But now with your sedentary lifestyle, you're sitting at a desk or you're in your OT sitting on a chair. Do you really think with very low physical activity, do you really think you need that kind of a carbohydrate heavy diet? Again, affordability. Now we can affordability, general affordability has gone up. So every time, I mean, at the drop of a hat, we are ordering from outside, we are ordering food from outside. Then earlier diet used to be for energy. So now do you need that kind of energy? Are you that active? You need to see that. Again, traveling. Earlier traveling used to be on foot or on cycle. Now everything is automated. So life is really quite sedentary. So you have to reassess how much energy expenditure you're doing and how much energy intake you're doing. Physical activity, or we used to have a lot of outdoor sports. All that has now been replaced by digital screens. We used to have leisure outings, picnics, and all. Now all that is OTT on television. Okay, earlier housework was by hand. Now it is all equipment and motorized and automated. So a sedentary lifestyle. Sorry. So the factors contributing to the current health conditions are mainly food availability, disposable incomes, food compositions have changed, more of fatty food, more of high carb food. Then physical activity, there is no stress on sports in school, lack of exercise, ignorance about exercise. This is my pet peeve when I look at, I live, the society where I live, and there is a gym in the garden, the garden gyms, and I see all these middle-aged people doing some really funny exercises which do not contribute in any way either to calorie burn or to increase muscle strength. So there is absolute ignorance about exercises. Ra- Then stress you have to, that is one thing which Moite ma'am has postulated, that you have to regulate your stress, because that can lead to a lot of other health issues and dysregulation of your cortisol. And also leading to certain habits like stress eating and also substance abuse. So stress is a very important factor. Circadian rhythm, late night. So our body works on a circadian rhythm. The hormone releases work on a circadian rhythm. So one should maintain a good sleep hygiene, which is very, very important. A 6 to 7 hours of undisturbed sleep is the biggest bank account that you can create for your health. Now, coming to certain food beliefs and myths. Oh, we don't use sugar, we use honey, we use jaggery. Then second is saturated fat. This is saturated fats needed for lubrication of joints is for the parents in our household, which is a very common thing. We eat a little ghee, it will lubricate your joints. Your synovial fluid does not contain any fat, it only contains proteins. So there is no lubrication over there. Okay, then milk. Us human species is the only species which drinks milk as an adult. Okay, and this milk is not a complete food for us, it is a complete food for the baby of that species. So the cow's milk is a complete food for the calf, not for us. Okay, so get out of this myth of milk is the complete food. Stop depending on milk for your nutrition. And ice creams are another thing. So these are just a few myths I came up with. I know not many people are aware that the ice creams that they also happily eat or give their children, those are only few. There are a handful of brands which actually sell ice cream made from milk. The others are all frozen desserts, and frozen desserts are made from dalda. So sugar and jaggery and honey, if you count the glycemic index of jaggery, in fact, is much more than that of sugar. Okay, and even the calories are almost similar in all three of them. So if you're looking at curtailing your calories and looking at some decrease of insulin resistance, then you have to just uh, I mean, you just have to understand that all these three are at the same level, only that there are some antioxidant properties in honey and it suits your throats and it will provide some vitamins and enzymes, whereas jaggery is good for iron and sugar is bad in the way that it is highly processed. But as far as calories are concerned, they're all the same, and the GI of jaggery is the highest. By that way, honey would be the least harmful of the lot. So this is a chart which can show you roughly how much you're taking in between this. So, in fact, a high fat content milk will increase your acidity. So, taking milk for acidity at night is counterproductive. And if you ask any gastroenterologist worth his salt, he will tell you not to have milk in the night. Okay, now these are some foods that you can take for acid reflux, which is another issue with stress. So, there are many other things that you can take for acid reflux, like fruits and green leafy vegetables. And of course, what you should avoid is the greasy food, the oily food, the fatty food, coffee, and alcohol. This is one way. So these are milk fats. So if you want to indulge once in a while, then you go for a pure ice cream. Do not go for a frozen dessert. FSSAI has made it mandatory that they have to write that this contains edible vegetable oil. That is your dalda. Okay, so basically all these fancy ice creams that you see in the market, okay, they are all dalda. So you're basically having a lot of saturated fat, or rather, you're having a lot of trans fats. Now coming to what can you eat? So one of my hero diets that I call it is the DASH diet. This is actually an acronym for a dietary approach to stop hypertension. It was formulated by the National Heart, Lung and Blood Institute to prevent and to control hypertension. It was actually, although it is not a medicine, but it is advocated as a first line pharmacological therapy for lifestyle modification with lifestyle. Sorry. One second. So, the DASH diet contains dietary components which affect the insulin resistance. So basically, because we want to tackle insulin resistance at the base of it all, what does the DASH diet contain that affects it? So it contains a good amount of fruits and vegetables, whole grains. It contains omega-3 fatty acids, low GI foods, and the minerals such as potassium, magnesium, and calcium, which is for control of hypertension. And you have to also look at your portion size, and it cuts out the saturated fats, the simple sugars, the salt, and the alcohol. So the DASH diet, the metabolic goals, if you look for in the DASH diet, it ticks all the boxes. It decreases your insulin resistance. It decreases your triglycerides, your LDL cholesterol. It will decrease the blood glucose. It will decrease the inflammatory cytokines like IL-6, and it will increase your adiponectin levels. It is effective against metabolic syndrome, in weight management, for hypertension, and also it decreases your cardiovascular risk, and it will also decrease your inflammatory markers. Okay. So you eat a wholesome diet which contains vegetables, fruits, whole grains, fat-free, low-fat dairy, fish, poultry, beans, nuts, and seeds. You avoid full-fat dairy, you avoid red meats, you avoid simple sugars, and you decrease your sodium intake. Your sodium intake should be less than 120 milligrams. this is what your diet looks like. A huge portion, the biggest portion of your meal should be mainly vegetables and fruits. Your grains should be whole grains. By whole grains, we are talking about whole wheat, millets, pulses, legumes, and not maida, sabudana. All those things should be avoided. Corn flour and all those things should be avoided. You can have lean meats like chicken, fish, eggs, and you can have plant proteins also, and low fat dairy can be included in your diet. So the carbohydrates can be derived from water containing vegetables, anything. So what do you say, a ground rule that you can follow is any vegetable which with a crunch will be high fiber and low calorie, because the crunch comes from its water content. So think of any vegetable that has a crunch, and that is what you can eat in abundance. And the vegetable which does not have crunch, that is the one which will be very heavy in your carbohydrates, like potato, suran, even peas, brinjal. So remember, vegetables with a crunch. Okay, low glycemic index foods. Again, fruits which contain a lot of water. So your melons, your citric fruits, they are no brainers. Just have them. Your apples, your pears, your plums, peaches. You can have those. The heavy fruits are the five fruits which are the which is your banana, your chiku, grapes, sitafal, and mango. Again, mango have only seasonal mangoes because they are a good source of nutrients and fibers. So have it, but have it in season. Don't start ordering for mangoes in February and March when they're not even in season. Use a good seasonal produce. Fats, the MUFAs and the PUFAs. So the polyunsaturated fatty acids are the essential fatty acids, because these our body does not produce. Body does produce some amount of MUFA, but it does not produce the PUFAs. So these are the omega 3 and omega 6. A good source are the walnuts, the flax seeds, the soybean. And these MUFAs you can get from your avocado, sunflower, canola, nuts, olive oil. So why are movers and poofers important? Are because they are required for the production and working of certain enzymes which are required for your immunity, for your for the control of your inflammation, and for your neurological functioning. So that is why we need these fatty acids. Now coming to the minerals like potassium, calcium, magnesium, these help in controlling your hypertension. They are endothelial relaxants, and they help in controlling of your hypertension. So, banana, orange, spinach, nuts and seeds, whole grains, leafy vegetables, these are some sources from where you can get these. Now, when we are looking at fiber we require for the control of your cholesterol. It adds a roughage, it decreases insulin resistance, can help in weight loss. So these are various sources which give you a good good amount of fiber, and a very by common sense you know that certain foods you can't eat too much. Like for fiber you cannot eat almonds because it will always also give you a very high, it is also high calories and give you a high amount of oil. So you don't eat almonds for fiber, but you can definitely eat something like broccoli, or you can eat a teaspoonful of chia seeds. So this is how you can plan your diet. Now coming to certain low glycemic index grains and legumes. So your black rice, oats, buckwheat, your kuttu, quinoa. Quinoa is a very good, so it's a low glycemic index grain, and plus it has very good protein profile. So you can replace your rice with quinoa. Chickpeas is also a good source of proteins, along with being low glycemic index. So you can have once in a while you can have chickpea salad. So that is also a very good option. Dals are always a good dals and sprouts are always a good source of proteins. Now, I had spoken about leucine. It is a branch chain amino acid. It is the best amino acid for protein synthesis, so especially helpful in sarcopenic obesity. So these are the sources wherein you will get a good amount of leucine. These are the animal sources where you can get a good amount of leucine. These are the plant sources for leucine, lentils, edamame, tofu, corn. Now we need good quality, high quality proteins. Now, if you look at this, this is protein per 100 grams of this substance. So, and one egg will give you 6 grams of proteins, but 100 grams gives 14 grams. So, when you're looking at these figures, remember that they are for 100 grams. Okay. So, these are all high quality proteins. These are the plant sources, and these are your animal sources. Now, again, you have to choose wisely. You cannot go for something like peanut, sorry, you cannot go for something like peanut butter or almonds for your proteins, because you will have to take in 100 grams of that. Okay, so obviously that will also give you that much amount of fat. So you go for something like quinoa, you go for something like broccoli, you go for edamame, you go for tofu. And for yeah, for protein sources from animal based sources, you can go for lean meats like fish, eggs, chicken. Now, coming to food labels, one has to start reading food labels very carefully. Okay, especially in India where there is a lot of ambiguity in the food labels. Okay, so when you're reading packages, you should see what is the serving size, and what and the food label is for 100 grams, and what is the serving size. Whether that is really your serving size, are you taking that much 30 grams of serving, or are you taking 60 grams as your serving? And then you have to extrapolate those nutritional values to your serving size. Okay, so fats, if you're looking at fats, the total fats per 100 grams should be less than 10 grams, and the total amount of saturated fats in that should be less than 3 grams. Then coming to fiber, the total amount of fiber per 100 grams should be more than 3 grams. Coming to sugars, the total amount of sugars should be less than 2 grams per 100 grams. And the Sorry, the total amount of sugar should be less than 15 grams per 100 grams, and the total amount of sodium, that is, it should be less than 120 milligrams per 100 grams. So this is how you should start reading food labels. Okay, and one should and how another pet peeve of mine is diet food. Whenever you buy any kind of diet chuda, diet save, there is no nutritional values written on that pack. Okay, so do not be fooled by all that. There is no such thing as diet in all these locally made products that you take, and then you think, okay, this is diet and I can eat 2 cups of this. Okay, so that is all hogwash. Now, coming to physical activity, do not be bogged down by what physical activity I should do. Do anything that makes you happy, keeps you fit. Okay, so anything and which is easily doable for you. If you are not able to go out, if you're not able to go to the gym, then you do something that you can do at home, or what you can do in your society. You can go for a walk in your garden. You can just if you have a treadmill at home, keep it somewhere where you can watch TV while you're on the treadmill. So one serial is for 30 minutes. You can watch one serial while you're on the treadmill and finish off your 30-minute walk on the treadmill itself. So in fact, if you like dancing, you can go for dancing classes. If you like Zumba, if you like aerobics, do anything that you like. You can go swimming. If you know swimming, you have a pool in the society, go swimming, but stay active. Stay active. What American Heart Association says that you should stay active. Do moderate amount of physical activity. If you can see, this is a person walking his dog, so that also for 30 minutes counts, okay, towards your physical fitness. If you have less number of days, then 25 minutes of, say, a slightly more vigorous activity you can do just thrice a week. Even that is doable. Okay, and if you want to do this for lowering your blood pressure or your cholesterol, then you can add high intensity workout to this, which can be done for 2 days a week. Okay, or or you can do an average of 40 minutes of some physical activity, moderate to moderate physical activity like cycling, which you can do for 3 to 4 days a week. Now, these are some figures which I like. Many a times people say I do get hunger cravings and sweet cravings. So these are certain things that you can have, which so the GI of apricots is the lowest. Okay. The glycemic index of apricots is the lowest, whereas the calories of all these three are the same. But this is for 100 grams. So now if you're not going to have 100 grams at a time, you may have something like 20 grams. So if you divide this by 5, you're just getting 50 calories in this. So instead of having a spoon of sugar or having that cake, you can just have some dried figs, or you can have apricots, or you can have black raisins. So this is how you can curb your cravings. At the same time, you can satisfy your sugar cravings. Okay. I want to show you two more charts which had come at the beginning. Yeah, so that. Yeah, here, this one. So these are certain foods that you all can go for. Okay, so certain foods which are low in calories, but which will give you a good amount of proteins, fibers. So you can go for quinoa, chia seeds, chicken, hummus. Even for munching, you can go in for makhana or kurmura. Broccoli is a good source of proteins, vegetarian source of proteins, eggs, fish. So Ravas is the Indian salmon, which will give you a good amount of puffer. So these are certain things that you can opt for. Now coming to our popular foods, how to choose wisely when you're snacking. So a samosa will give you 300 calories, a burger 400 calories, but a batata vada is 156 calories. So you can feast by being mindful about what you're eating. Okay, even coming to sweets, a sandesh will give you only 100 calories, whereas a gulab jamun, the same volume, will give you 340 calories. So these are certain ways in which if you eat mindfully, you can still enjoy. Thus, with all this, with your dietary approaches and with your physical activities, your lifestyle changes, you are striking at the root of all these lifestyle diseases. That is, you're striking at the root of insulin resistance. And thus, this you will be able to break that cycle of insulin resistance and of obesity, and you will be able to lead a healthier life. Sorry, just done this. Thank you. With that, I come to the end of my talk.
Thanks a lot, Swati, for that enlightening talk. You really made weight loss sound so easy. So I think most of us are now motivated to go for small 30 minutes walks. Thanks a lot. We'll take few questions which are there in the chat box. So,
Talk
Madam,
share.
Mohite Madam, can you unmute?
Yes.
Yes, Madam. So first question is for you. How to do emotional self-regulation in difficult situation? Can you throw some light on that? Emotional self-regulation.
Actually, it is very important to learn certain techniques and be ready. We cannot appear for any examination without studying, isn't it? So, similarly, we cannot face any situations when we are not prepared for it. And the techniques are quite simple. We can learn it, we can self learn the techniques and use for ourselves. And it starts with awareness and then learning simple techniques, knowing our own personality, knowing our strengths, knowing our weaknesses. That will give us information about our own selves, and then we will be able to uh, tackle the situations much more easily. Emotional intelligence is extremely important, by which we can understand our own selves, otherwise, and also the opposite person.
Yeah. Thank you, madam. There is one more question for you. If you can you please explain the rule of 5, 4, 3, 2, 1?
Yes, it is a method when we are facing any acute problem. What happens is we go in the cycle of overthinking, and the same thoughts keep on coming to us again and again, and we are not able to think clearly for that situation. So, for that, we have to break the cycle, and this is just breaking the cycle. And here we are using our senses for it. Rule of five is to see five things in operation theater quickly and notice them. Four is to touch different surfaces in the operation theater itself. Three is you listen to three sounds in operation theater. Two is smell, and one is taste. So many times it is not possible to taste anything else, but you can taste your own saliva then. But taste it mindfully and break the cycle so that we are able to think clearly.
It is just to break the monotony or
Yes,
break the
yeah,
negative cycle
that
of negative
cycle.
thoughts, and
Yeah,
then take a break and come back again.
yes.
Yeah. Thank you,
And
madam.
it takes less than 1 minute.
Yeah. So small break. Yeah.
Yes.
Okay. Next question for Swati. We anesthetists are constantly inside the OR. So any suggestions for the diet and exercise for us with our kind of work and long working hours and probably, long nights and all?
So here I would say that discipline is key. Okay, so it is about I remember once I had read or heard an interview by Virat Kohli that they do the same boring things every day and achieve excellence. It is not that they do something extraordinary, but the same boring things. They eat the same food that is recommended by the coach every day. They do the same practice every day, but it is done every day at that time consistently over so many years, and then he becomes Virat Kohli. So that is your consistency is your key, and your discipline is your key. So that if you are going to wake up in the morning, do that 30 minutes of workout or whatever, your 15 minutes of yoga or whatever, just do that. Carry something, make healthy choices, prep for it. So if you are going to carry something to the OT, you can have this small dabba of dry fruits, 5 to 6 almonds or 3 or 4 walnuts, put 2 anjeer in that, that becomes your small dabba of snack. Okay, you can carry one small dabba of makhana to munch in the middle, so that you don't go and order that vada from the maushi. Correct, because otherwise that is the next option कि नीचे से मंगाते हैं, canteen से मंगाते हैं, which I know about, because you are hungry, you are really hungry at that time, what to do? But then if you have these options with you, if you're carrying something with you, just carry an apple in the bag, and eat that apple. Carry a banana, okay? You can do your carb loading in the morning with a banana. Carry something from home. Have the options ready with you. Only then you will not order from outside. Again, if you have to order, then see that you're ordering light food, or maybe idlis, or you can if you have to go out, if you need to go out to eat at night, then order something which is grilled or roasted, rather than something which is laden with gravy. Food, I mean, canteen options are really bad outside, so try that you don't, another habit is keep a spoon. Learn to eat with a spoon. So, don't, if just because the dal is there, don't try to finish it with another serving of roti or rice. Finish the dal by itself, okay? And avoid the gravies, avoid the oily food. So all these small small things, just become mindful of what you're eating.
Yeah, that's a great suggestion. And one more actually burning questions nowadays. So another way Madam has asked, but I think all of us know many of our residents are practicing intermittent fasting nowadays with their kind of hectic schedules and their night duties and all. How healthy this intermittent fasting is for them?
It really depends, because time restricted eating does have its benefits. Okay, I would say that I was at my fittest during my MO shift, which I did in a small village near Nasik, where we used to finish our dinner at 8 in the night, because it would just be lights out after that. So 8 in the night we would finish our dinner, and the next day would be directly tea in the morning after 8 o'clock. So 12 hours would be properly fasting. It was kind of an intermittent fasting. So time restricted eating just helps to curb your insulin, because insulin is an anabolic steroid. So anabolic hormone. So you have to see that you are not stimulating your insulin at odd hours. So whatever suits you.
Yeah. Okay. Yeah. So they have to be
I would not say so
careful.
much of intermittent fasting, and as I would call it, a time restricted eating.
Time
Do not
restricted.
have
Yeah.
late night bingings. Do
No,
not,
because nowadays there is I mean, everybody wants to lose weight, everybody wants to be on a thinner side.
yeah,
And
but see
yeah,
to it that whatever you're eating, even during the eating window of intermittent fasting, is not
that is
unhealthy.
healthy. Yeah.
But this misconception that you can eat whatever you want during those 8 to 10 hours, then that you completely negate the benefits of your intermittent fasting.
Yeah,
Okay, so
that's true.
whatever you're eating, that also should be mindful.
Yeah. Okay. Thanks a lot. And thanks for the wonderful discussion. I now invite our chairpersons to sum up the webinar. Anita, madam.
Yeah, I think it was a very useful session, both the session, and very insightful lecture by Madam. Madam has beautifully explained the various therapies like behavioral therapy, emotional therapy, and such as cognitive therapy, how to cope with stress and when to seek help also. So thank you, Madam, for such a nice session and thought-provoking lecture by Dr. Swati Pradhan. She has really shown us how to manage our lifestyle diseases where we need an holistic approach, with balanced diet, regular exercise, stress management, really a thought-provoking lecture. So I would like to thank both the speakers, Dr. Moite Madam and Dr. Swati Pradhan, for an interesting session.
Thank you.
Sona, madam.
I thank Cooper Hospital for organizing such a wonderful session today. And thank you, Mohite madam. It was excellent listening to this talk. All of us are undergoing emotional turmoil, but it was very well explained, madam. And Dr. Swati Pradhan, your talk was excellent. It gave us a lot of insights into the recent dietary plans and all. Thank you very much, both of you. And thank you, Dr. Naina and Dr. Anita
Thank you.
Shetty. Thank you very much.
Yogita.
Thank you, both the speakers, for really excellent lecture and really creating a great awareness among our fellow anesthesiologists. I thank all the participants who really made the sessions interesting and quite a few senior madams. So it was really nice to chat and bond with you all on Zoom platform. So really happy to see all of you. And special thanks to Ganesh and technical team for their behind the scenes efforts in making this webinar a success and definitely an impactful one. So with this, we conclude today's session. Let us carry forward the message that The wellness is not a luxury, but a necessity for every anesthesiologist. Thank you and wishing all good health and balance in your journey ahead. So thank you all from bottom of my heart. So good night, all of you. And special thanks, Shubha Moite, madam. It's already so late for you. So really thank you. And I look forward for you in future also for such sessions. Thank you so much, ma'am.
Thank you.
So good night, all.
Thank